Hello and welcome to Mitigate This, the podcast where we talk about the risks you can't see and how to stop them in their tracks. From microbes with main character energy to outbreaks that rewrite the rules. We break down the biology, epidemiology, and real-world dangers behind the headlines. And more importantly, what can you do about them? Just here to avoid becoming a case study, you're in the right place. So wash your hands, lean in, and let's get to it and mitigate this. All right, friends and listeners, this episode just leveled up with invasion of the Brain Snatchers. Today's guest is someone you want on your outbreak response team, Michele Hom. She's an infection preventionist and clinical laboratory expert with over 20 years in healthcare, and she knows how to turn complex science into real-world impact. With a master's degree in biotechnology and business administration, plus certifications in medical and public health microbiology and infection prevention, Michele lives in the intersection between science, strategy, and safety. She's a laboratory manager, infection prevention consultant, and a proven leader known for driving efficiency, strengthening collaboration, and improving patient health outcomes without losing sight of the big picture. Smart, practical, and fearless when it comes to public health. Before we get to it, I want to break down the CNS, which think of your body like Tron, that glowing digital world inside the computer. The brain is the master control program. It runs the systems, makes the decisions, and keeps everything in sync. The central nervous system, in short, the CNS, is the entire grid, the brain plus the spinal cord. It works like a light beam of data running through your body. Every moment, sensation, and reflex is a pocket of information racing along that beam. Touch something hot, the signal flashes in your brain. The command fires back. Your hand pulls away before you even realize it happened. So if the grid is running smoothly, everything works. But when a pathogen hacks the system, the whole program can start to glitch, and that's when things get dangerous. Let's take a moment and discuss the different types of organisms to help our non-biology listeners. Take it away, Michele.
Sure. So rabies is definitely an ancient disease, over 4,000 years old. There is some interesting Mesopotamian text that talks about quote unquote mad dogs, so that we know that this is, a long time disease. It is a virus. So viruses are typically tiny infectious particles, definitely smaller than a cell. It cannot be seen with the naked eye. So in the lab world, we use something called an electron microscope, and this is at the big fancy laboratories. And then they can actually take a picture of it and then blow it up for us to see. So what happens is this virus typically, it'll invade a living cell, it hijacks it, and forces the cell to make copies of the virus itself. And then the cell explodes, leading to more virus. Rabies is definitely an interesting virus. It attacks the central nervous system. So typically what happens in the infection is that you are bitten by, in the States, it's usually a dog or a bat. It can be other animals, raccoons, coyotes. I would definitely say don't touch wild animals, kids and adults. And if you see bats, don't touch those either. Even if you're trying to help it, you don't want any kind of issues leading toward any kind of rabies.
Thank you so much. I didn't realize that you could have rabies in raccoons. This is a very interesting topic, especially as some of us live in more rural areas. So let's set the stage. What actually happens when rabies infects an animal or a human? How does the virus get into the body, travel through the nervous system, and ultimately take over the brain?
So, animals, it's transmitted through a bite, through their saliva in the bite. And what is a little worrisome is you definitely would probably feel a bite from a dog, a raccoon, a coyote, but not necessarily a bat. And this is what we are most worried about. Bats can bite you even in your sleep, and you might not necessarily feel them biting you because they have really tiny little teeth. But it is the saliva that gets into um, the muscle cells near the wound, and then it then further binds to nerve endings and travels upward to the nerve fibers in your spinal cord and then eventually the brain.
Wow, that sounds extremely concerning. I recently heard a story about a a bat that was found and a small child picking it up and playing with it. And the really scary thing about it, it actually did have rabies. And there was potential because the bat was still partially alive for it somehow to communicate either from the saliva, the girl maybe touched her mouth, those fun mucous membranes. Um, but tell me a little bit about what happens if there's a risk. So you talked briefly about a bat being in your house. There's this really interesting story about a mother that woke up and found a bat laying on her son's pillow. So again, there's risk, there's change in behavior. So will you talk to me a little bit about what do you do once you've identified a risk, either from a known bite or from the potential exposure to something that might be infected with rabies?
If there is even an ounce of exposure, you definitely want to go to the emergency room or your closest clinic and get in touch with your local public health. They will initiate what we call PEP, and that's pre-exposure prophylaxis. It's a couple needles of basically antibodies to rabies that they apply at the wound or usually in the abdomen, depending on if there is a wound or not. But you definitely want to talk to public health, get them involved. With PEP, it's about 100% effective if it's early detection or exposure.
And if you feel like you need to get some pep, where do you go? Where can I get this? Can I go to my PCP? Do I have to go to the ER? Tell me a little bit more about that.
Well, typically it's going to depend on your county and where the PEP is located. In our county, it's located at our emergency rooms, but in some rural counties, it might be located at clinics. So that's definitely why that you need public health, coordination with public health, so that way they can direct you where to go.
If you have an animal that potentially bit you, and this could be a dog, bat, raccoon, if it was able to be contained, how would it be investigated from the public health and laboratory perspective to assess if they had some sort of viral pathogen like rabies or something else going on with them? What part of the animal must be analyzed, and where is this virus typically found?
Um, So for all you animals lovers out there, the animal in question will be put to sleep because we will need to extract the brain in order to test to make a definite diagnosis of rabies. So this is why I say don't touch wild animals because then we end up putting them down for sometimes no reason. So we'll extract the brain matter in laboratory. We make some slides, and we either analyze it what we call a direct fluorescent antibody, or we analyze it with molecular methods. In some instances, if it is human that we are questioning, we can sometimes take ocular fluid and utilize that specimen for a diagnosis. But I would say typically if we're getting ocular fluid, you're at the end stages of rabies.
So, are you saying that if I have rabies and I'm a human, I can transmit it to another human?
If you bite them, yes, like a zombie.
Michelle, this is fascinating, maybe a little unsettling for some. Okay, officially nightmare fuel. learning how rabies progresses, and that it can even show up in ocular fluid in the eyes. Wow. It really drives home how the virus gets into the central nervous system. It goes all in on invading the brain. So let's ask the question that everyone's thinking. Can rabies spread from human to human?
It's I am not aware of that, although it could be possible. Typically, when it's further up in the brain cavity in the CNS area, you're heading towards a coma. So you're definitely hospital bound. So some of the stages, so this early stage, if you are unfortunately infected, and do not get any kind of PEP, any kind of uh, post-exposure prophylaxis, um, you're going to go into an early stage, which we technically call that the prodromal stage, which you'll experience like flu-like symptoms, pain, maybe some tingling at the bite side, anxiety, maybe some fever, which is, everything causes flu-like symptoms. So typically not something that would set off to a physician thinking of rabies.
So it's probably not coronavirus, you're saying.
Oh gosh, yeah, corona, any kind of flu, adenovirus, all those cause those flu-like symptoms.
We are in the winter season, so
Mask up, cover your cough. So then the next stage is kind of like the paralysis stage, and that's where it's interesting. There's hydrophobia. So out there, anyone who doesn't understand what that is, it's where you're scared of water or you don't want to be near water. And it's not that you're gonna, jump away from the ocean. It's because when you try to swallow, you start getting muscle spasms. So that's why you see some of the patients start drooling because they don't want to swallow their saliva because it's very painful. You also see some agitation, so hyperactivity. So when we look at animals that are in the neurological stage of rabies, you'll see, for instance, bats flying around during the day. That's not normal for them. You'll see hyperactivity and aggression of coyotes, foxes, raccoons. And then, it goes toward starting the paralysis stage. You'll also have sometimes there's excessive sweating, and then the salivation and tears. And then the final stage is the delirium, paralysis, coma, and then eventually death. And that's typically due to respiratory arrest. So you have asphyxiation, since the brain is what's controlling your breathing.
so you did talk a little bit about the eyes, and it makes me think of the lacrimal duct, that duct that goes from your eyes, it drains into your nose, ear, nose, throat. Can it go the other way? So is that fluid backing up the other direction to go into your lacrimal ducts to go? Is that how it's coming out of your eyes, or why do your eyes start getting more moist?
It's just it's an autonomic issue, and it has to do with since the um, rabies virus is attacking the brain, it's kind of making your brain haywire, hence, the agitation, the aggression. So some of the kind of the autonomic issues that occur.
What if some of our listeners are concerned about getting treatment? So this is something that public health deals with on a regular basis, thinking about what if I wait to see if I really did get bitten by this bat or scratched by something? Oh, so what would you say the survival rate is, particularly in humans? Can anyone survive if they start showing signs and symptoms?
Currently, it's pretty much a 99% fatality. There, interestingly, in 2004, there was a case where a 15-year-old, I believe she had found a bat that got hurt at her church. So of course she was trying to carry the bat outside. The bat bit her. Mom and dad didn't know about it. And then she started exhibiting symptoms of the rabies virus. And then incidentally, so they tried this Hail Mary pass called the Wisconsin Protocol, also called the Milwaukee Protocol. by a Dr. Rodney Ullaby, I believe is how you pronounce his last name. And what they did was in order to relax her brain, they induced her into a coma, gave her therapeutic drugs. They loaded her up with antivirals and supportive therapy, so she was on a vent. And they were just trying to let her body fight it off. And she actually survived. It was a little bit of a road to recovery. She had a lot of physical therapy, but she's still alive today. I believe she has kids and is living a pretty normal life. So definitely it was a shot in the dark and it paid off. I believe they've tried this protocol other times and it has not worked, unfortunately. So again, if there's even a chance, I would definitely reach out to public health and talk to them about, getting prophylaxis or, what happened to induce a bite.
So, with everything summing up, how do we mitigate the risk for rabies? You want to just give a quick summation of what your recommendations are and how do we reduce the risk?
Yeah, my recommendation is don't touch wild animals. Please. They have other things than rabies you have to worry about. But yeah, so don't touch the wild animals. If you find yourself in contact with a bat, or even if what you wake up one morning and there's a bat flying around in your home, definitely contact public health and go from there. We really want to get you treatment as soon as possible.
Thank you. And now, this next one, I'm so excited to talk about. It's going to be really fun. Naegleria fowleri.
Yes, Naegleria fowleri. That's how I pronounce it.
Mm.
Tomato, tomato.
So this is typically known as the brain-eating amoeba. So it definitely ties in with the theme here. And so let's break down what an amoeba parasite is first before we even get into this.
Sure, yeah. So an amoeba parasite, it's a single cell organism that can live inside the body or outside the body. Sometimes it's in our gut or in the host gut. It doesn't necessarily have to be us. It could be any kind of animal. And it typically survives feeding on the body's nutrients, sometimes cells, which, for us can lead us to get sick.
Wonderful. And do you know the origin of Naegleria fowleri?
So,
Naegleria.
there has
Sorry, go ahead.
Naegleria fowleri. Yeah, it's a tough one. So it is also an ancient disease. There's descriptors in the book about this causing, death and decay of humans. But it was recently, I should say recent, because it was in the 60s. It was found by an Australian scientist. I believe his name is Malcolm Fowler. It's Fowlery. You like to name things when you find them after yourself.
So, oftentimes there's a process of really looking at the nomenclature, which is naming based on species or family, genus, really looking at the specific scientific origins or ancestry. However, you can also name a bug. There are many zoos that are doing name a bug campaigns, and this is a bug, this is an organism. And there's even fundraisers that you can name something after your ex or after a famous person for their philanthropy or whatnot. What would you call your bug?
Fortunate, because I would really like to find a bacteria and name it after myself. I already had a name picked out.
Ooh, what would the name be?
The Salmonella.
I love it. And amoebas are very interesting. They could be fluid in multiple mediums. What environmental concerns should I think about when I'm thinking about this brain-eating amoeba?
So this is an interesting one. So this parasite likes to live in warm water. So those are hot springs, lakes and rivers. So we're talking about freshwater parasites. Usually they like it between 86 to 115 degrees Fahrenheit, or if you're into Celsius, 30 to 46. And it enters through nasal passageways. So, we're hanging out at the nice hot springs. We think it's hot water and nothing could survive this, right? Well, you're wrong. And then you just take a little dunk in and accidentally get some, water up your nose, and it happens to have a parasite, and there you go. The fun begins.
So I'm thinking about spring and summer. Are there a lot of risks if I want to swim in the rivers? Are there notifications that would go out, such as when you go swimming at a lake, oftentimes, or a river, they'll give you um, the public health rating of that body of water. Does it ever include if this has been identified, or would they shut down access to this lake or river, a beach, maybe even if this has been identified?
Yeah, so they definitely shut down. I have not heard of it at any kind of beach, but that doesn't mean it doesn't exist. Typically they will shut down the body of water, but as there are people out there that don't pay attention to signs, don't read signs, feel that fences are not meant to go around bodies of water, and they'll just go into that hot springs anyway. So, definitely something to think about prior to entering natural hot springs.
I think I've seen that movie and the guy dies at the end.
Yes, this is definitely one of those 99% fatal organisms, diseases.
So, how does it get into the brain? Isn't there supposed to be a blood brain barrier that prevents some of these different pathogens from getting into the brain?
Yeah, so amoebas are really interesting creatures. They can move in between blood-brain barrier, and that's their nature. They can squeeze into tiny little holes back and forth, and so it becomes easier for it to get up to the brain, where that's where it likes to be. That's where it wants to destroy your brain cells by releasing enzymes to dissolve your brain cells, and then they in turn digest them and absorb the nutrients. You also, eventually have mass inflammation, tissue damage, and then you have coma and then death.
What would be signs or symptoms that somebody has been exposed?
And so typically this one's a fast one. So unlike rabies can be anywhere from days to a year to actually start really showing signs. With Naegleria fowleri, it's between 1 to 10 day-ish incubation. So after you have the infection, you will experience severe headaches, fever, nausea, vomiting, stiff neck, sometimes changes in taste or smell. You can exhibit nasal discharge or blockage, which all those are very common symptoms for any kind of organism. And then, after that, it becomes rapid progression. So you have confusion, disorientation, your balance obviously is off, dizziness, and then you start having hallucinations, seizures. And that part is due to the inflammation and the tissue damage that's occurring in your brain. And then eventually coma, then death.
Is this often diagnosed in the early stages, or is this often found after death, like an autopsy? So,
Typically found after death. Because the symptoms are so broad, unless you really tell the physician, hey, I was in hot springs, they really just don't think of this parasite initially.
so you really have to have a self-aware patient and a really thinking outside of the box physician or clinical practitioner, it sounds like. So once it's diagnosed, are there treatment options? Is this fatal? Can you survive this?
Yeah, it's pretty fatal, anywhere from 97 to 99% fatality rate. You can typically anywhere from 10 cases I've heard of survival. In I would say in the states, in the contiguous states, usually we see this in Texas and Florida. And that seems to be the breeding ground for Naegleria fowleri, although there have been cases in California. It's rare. I would say anywhere from 1 to 8 cases per year. So it's not something that decimates the human population, but something that, it can occur.
So, one place that I found really interesting, because typically you would find it in all these different outside environments. However, it's also been transmitted to people using nasal rinse devices such as a lavage or a neti pot, where it actually got into the water system in someone's home. Is that because of chlorination or some other reason, or how did it get transmitted into our drinking water? And does that put us more at risk for things like nasal rinses and whatnot? Should we use sterile water, clean water, distilled water?
Yeah, so interesting. Naegleria is not typically something that we worry about with potable water, but there is another parasite that is very similar called a amoeba. And that, yes, if you use non-potable water, if you use, river water to try to use any kind of neti pot, there is potential for exposure to this amoeba, to a amoeba. I would suggest if you're doing a neti pot, you get that the distilled water from the store, just safer. I would say if we do see this, it's because it has to do with your water treatment plant. There could be issues. Maybe someone tested incorrectly. Maybe there was the wrong chemical amount that was put into our drinking water to make it safe. So, there is always a chance that can occur as well, causing acanthamoebas.
Since you brought up acanthamoebas, do you know the origin of acanthamoebas? And what?
Oh man. I'm not quite sure the origin. Typically in the medical field, we don't necessarily see this causing any kind of meningoencephalitis. What we do see is it causes keratitis, so painful eye infections. So that's usually because people have contacts on and then they're using the tap water to wash their contacts instead of contact solution.
Oh, contact solution. That's a good point to think of. Tap water should never be used for contact lens solution. Tap water isn't sterile and can contain organisms like the acanthamoeba, as you discussed, which can stick to a contact lens and cause severe painful eye infections. If you're having eye pain, redness, light sensitivity, or blurred vision, remove your contacts immediately and switch to glasses, and seek prompt eye care as soon as possible.
Nasty stuff.
Thank you for listening to Mitigate This. From rabies to Naegleria fowleri, prevention starts with awareness, evidence, and action. Until next time, stay curious, stay grounded in science, and keep mitigating this. Thank you, and goodbye.